Howdy, everyone. Let me ask you a question. Where is that intersection between doing what is patient wants and following like things like clinical prediction or, clinical practice guidelines or protocols? Where is that intersection all while keeping a patient happy? Where is that? But first, let me introduce myself. I am Matt the PT. And I'm coming at you with another video on a topic of something that goes on in the physical therapy world. Next, I would like to thank you so very much for subscribing to the channel. Thank you for taking your time out of the day to listen to me ramble and talk about these things. Thank you so much. And if you like the video, hit the thumbs up button and also join in the conversation. Comment down below your thoughts, your beliefs, what you've seen, what you have heard from others. I do believe it's very important to have a discussion on this. And the more that we talk, the more that we can get to the bottom of a lot of this and have a better understanding with one another. Now, I know last time I talked about that evaluation, the people that just treat blindly. They get the prescription, they look at the diagnosis, and that's what we are treating. And I'll say I've had several people reach out to me, and we talked about it a little bit, and many people say, no, I don't do that. I've never done that. Or they say they don't do it now because maybe in the past they did early on, but they say, no, I do my own evaluation. I assess everyone coming in because what is going on may not actually be true. There could be other things going on. That's very interesting. That's very good to hear on it. Now, I know that it's a small sample of just people reaching out and talk to me. Like I said, I've seen the stuff in the past where there's therapists I've worked alongside that do just seem to treat blindly. Like, oh, lateral epicondylitis, we're just going to do everything for that. Hip bursitis, we're just going to treat along those lines. But I want to talk about today, moving over to the next part of what we do with patients. So we just don't just evaluate them, we treat them. We do treatments too. And how often, now you probably don't do this, but do you feel like colleagues or things like that treat to just keep a patient happy and coming back? And they're not really treating, what the clinical practice guidelines say or following protocols. Because like I said, somebody has stated in the past that 20-30%, I need to look that up. I'm sorry, I didn't get that out last time. But 20-30% of therapists don't treat to practice guidelines on that. And why is that? And somebody will quote that, and people who don't like therapy will quote that to say, oh, look at, the therapists, they don't do that. But I think there is a pretty good reason for that. And it's the fact we want to keep people happy. We want to keep our patients satisfied and happy, but it's often kind of looked at in the short term. We're thinking about that now on it. And I think it really comes from, one, we have the desire, we want to help everybody. We want to keep everybody happy. We want to get people functioning. That's what we got into this profession for, because we want to help people. But I've seen this with students, and I'm not going to bash students. I know I was the same way when I was a student. But when students come in, and I've had many over the years, that when I see them, they want to keep everybody happy. They want patients to be happy. And, we don't want anybody yelling at us or getting upset with what we do. And especially we want to keep our CIs happy, the clinical instructor. We want to keep them happy because they're grading us. And we want to pass that clinical so we can go finish school and go on to the next things. We want to do those things. And so they may not do what's followed, but do the things that are really, really needed, because I don't want to push this person and make them upset with me. Now, I will say with students, they are very good at bringing in, the practice guidelines and what you should be doing for, protocols. Very good on that. They know them, mainly because they're more fresh in their heads, but they'll come in and do those things. And I will say, I have seen students utilize those way better than seasoned clinicians. Yeah, that they'll say like, no, we need to be on here. We need to do this. And they have a way, I don't know, I guess maybe the patients just see that they're a student and just say like, oh, okay, yes, I'm going to do what you asked me to do. And they will. So I will say students do very, very well on that. But I think that starts that thing inside of us that we want people to be happy on it. And then when we start practicing, and I think this happen in, if you're working for a bigger company and even in private practice, and I'll talk about the bigger companies first, but we get management, and I may bash management for, I don't mean to bash them, but I'm probably won't say things that are like super favorable. I was management for many years on it. So I have seen this, but that the focus turns from really doing what a patient needs, like following the protocol, like protocols or practice guidelines and saying, hey, we need to be doing these things. And patients saying, no, I don't want that. I want this. Because and Chad Cook talked about this, that there was apparently a study where patients chose their treatments, like, they had like a menu board and they picked it, and they said they just weren't very good at doing that because they don't know. That is not what their knowledge is. Their knowledge is not in the treatment of musculoskeletal disorders or vestibular or neurologic. That is not what they have their education and training and, experience in. So they don't know what to pick, and they may just pick the things what they think. We are the educated people in that who know what to pick. Likewise, if the roles were reversed and we were going into their profession and trying to make a decision and do things, they would be the expert to be able to tell us what to do. But I believe that patients come in and have this, belief of this is what I should be doing. This is what my treatment should be. And there's a percentage of people that just want to, that don't want to do what we ask. And to say like, hey, we got to follow this. And they're pretty vocal. And I have had this happen in the past that patients get upset that I say, no, we need to be doing this. And they get upset. And what do? They complain to management, either, through some complaint line on it, or maybe on surveys. I've seen that with surveys that they mark things unfavorably and, they're not satisfied on it. And then or fill out cards saying that they're not satisfied because of that, we weren't doing the passive things. We weren't doing massages and hot packs on them. We just weren't, real light and gentle on them. I'm not saying we were rough or anything, but that's what they were wanting. And then management comes down to say, no, you need to do what they want. You can do these other things, but you got to I hated this. You say that you will give them the massage or the soft tissue work or the hot bath, but they got to do, so you got to get into this negotiation thing with them. And so now it's tying, me getting, I'm not going to say written up, but these verbal reprimands from management because I'm not doing, I'm trying to follow what the practice guidelines are and do what is right for the patient on what they need. But in terms of wanting to keep them satisfied, okay, I have to do these things. And I do feel like over time, as that goes on, it wears you down. It wears you down. And I think that also leads to the issues that you get, that you have the, again, that student coming out that pushes people, who follows the, the practice guidelines or, protocols or something, but starts getting complaints against them. And it chips away at their confidence and their abilities. And it makes them give in a little bit more and give in a little bit more and give in. And it turns into, I don't want to rock the boat on it, because I've had, and it just seems like if you get one, it's one too many patients that ever say anything about you. And then you kind of get labeled as this person on it, and they will just be on you. I have seen that with myself. I've had management do that to me. I've had colleagues that are doing what is right based upon the evidence out there, but because it didn't line up with what management wanted, that they look down on that therapist. I even saw it recently, unfortunately. Now, the flip side of that, I think as well, there are clinicians who utilize that to their benefit. So either one, they're working for the big box places and they're just, everybody's patients just love them. They just love coming, working with them, and they're, able just to keep a full caseload. And, maybe, because you get bonuses, and you can't, I'm going to say you can with some companies, you can get bonuses and stuff based upon how many people that you're seeing and what you're billing and doing all that. And that they're keeping their caseload full because they're doing all those things. Well, I'm not going to push them, but I'm going to do the stuff that they're liking and really, really wanting, because heck yes, it feels good to lay on a hot pack. Like, heck yes, it feels good doing some of that stuff. I'm going to tell you what, it does feel good. But that's what they're going to do. And they just keep people coming back. And so they're saying, oh, well, look, they have high satisfaction scores, so therefore they must be doing something good. So that, we're going to reward them. Or likewise, somebody's having a private practice. And I've seen that with people with private practices. I have said this before. I have legit saw somebody, he was commenting on something, and I happened to go look at his page, and he bought a ton of followers on it because the metrics were not off. I mean, I think he had like 60-some thousand followers, but like barely double-digit likes on post and not a lot of engagement. Anyway, that's besides the point. That's probably something we'll talk about down the line. But went to his clinic, and he was listing treatments that, ultrasound and ionto and phonophoresis and ultrasound and listing. So we're going, utilizing these things that there's not a lot of evidence for, and that are not in practice guidelines. And I know I'm talking, probably people are going to bash the practice guidelines. I'm just using that as an example. Okay. Just calm down on that. We'll talk about practice guidelines later. But looking at that going, they are using that to just keep people coming back, paying whatever out of pocket to keep coming back because they feel good. And so they are not practicing what those guidelines really are on it, just because they're utilizing those things. And I think some of that holds us back as clinicians. So, one, I do feel like we should call some of that out, that, when those things happen, we need to bring light to it. So yes, if somebody is just doing spa treatments, letting, people know that's a spa treatment. Like, yes, you're going to feel good, but is it going to help you in the long term? I will straight up tell people about that. There's places here in Texas that don't hire therapists, that don't physical therapists or physical therapist assistants or anything like that, but they utilize a lot of just kind of like roundabout stuff for it. So, stretching and massaging and a lot of the modalities, and it gets passed off as a therapy. And I'll tell them, it's like, hey, yeah, that stuff feels good. And it just keeps you coming back. That's all it is. It just keeps you coming back because it feels really good. It's not really helping you. You still have your problem going on, and it keeps creeping back, and I think that's important. And I also think it's important to call it with management. And I did point it out when this happened on that, to say, like, yeah, this person is being treated unfairly because they are practicing correctly. And you could see that this person had gotten beaten down by it. And it was just worn down because they weren't being supported. And I am not ever afraid to say that to any management anymore on that. To say, like, I am treating patients based upon what evidence says. Now, I'm going to talk with patients as well to say, yes, I understand that you may want this, but let's talk about that. And that's one thing I'm going to do with patients. I'm going to talk to them about that. Let's have a discussion. It's not a one-sided talk. It's not me commanding and telling them. It's a discussion. It's a talk and conversation, and we're going to go through all of that. But, you're going to get somebody who just doesn't want to do it anyway. But to say, that's not really what you need. I understand that you may be looking for right now, but let's look at further down the line. What's going to happen in a month, 6 months, 2 years? if we're doing these things now, what are we sacrificing on that other end? And I'll tell management the same thing. Yeah, I'm doing what is, what evidence shows. Can you show me the evidence for this other stuff? And they many times kind of slink away when you do that. Anyway, not to bash anybody like that, but I think that's some of the problem with getting into some of the treatment, that it's just geared toward just keeping people happy in the short term, rather than saying, no, we really need to focus on the long term of where we're really, really trying to go with this. And I think that would bring up the standard on it as well. So students out there that listen to this, keep it up. Keep pushing people. Keep pushing your page. Keep following those things. Keep progressing this forward on it. So there you go. Thank you so much. And if you liked the video, hit the thumbs up. And of course, please join in the discussion on the comment down below. Your thoughts, your beliefs. Do you see this? Have you been reprimanded for it? Have you seen other people who do those things? I want to hear about it. I want to hear. Let me know. Talk about it. So there you go. And of course, subscribe to the channel for all these wonderful topics and discussions as well. So until next time, take care of yourself, take care of your patients, and I'll see you then.